It's a cool summer morning, and Sheila's leisurely horse ride, one she's done hundreds of times before, is about to take a tragic turn. Without warning, the horse bolts, throwing Sheila to the ground. Found unconscious, Sheila is flown to Toronto's Sunnybrook and Women's College Health Sciences Centre.
We were 6 kilometers from either the nearest house or even 4 kilometers from the road. I had a 15-minute window. If I'd have stayed and even doing CPR on her, I could have been there for 2 days. Nobody would have seen us.
Originally, decreased all the way at the scene.
Sheila arrives at the trauma unit in a coma. It is likely she has suffered serious damage to her brain, and the team must quickly assess the full extent of her injuries.
Her blood pressure has been as low as...
The GCS scale rates the severity of a brain injury. Anything below 8 is considered severe, and Sheila scores a 7. Now it's clear to the team that this young equestrian is living on borrowed time.
Could someone get right here?
It's been 14 minutes, and Sheila was brought to the trauma unit in a coma.
She was not responding appropriately. She sometimes actually had evidence of going to coma, going in and out of coma.
She had a GCS of 7.
And she started having seizures. Right now she's a person who had a head injury, came in coma, so these patients have a high mortality, and usually even those that survive also have a chance of not doing well.
Dr. Rizoli needs to get Sheila to CT and find out what's going on in her brain. But the team discovers a more urgent problem. Sheila has a collapsed lung and is struggling to breathe.
Chest, she has 4 broken ribs on the right side. She has about a 10% pneumothorax on her right side.
I want to get ready to put a chest tube.
Failing breath and possible head injury is a deadly combination. Dr. Rizoli must insert a chest tube and reinflate Sheila's lung before her brain literally starves to death. It's been less than 20 minutes since Sheila arrived at Sunnybrook Hospital.
With most patients that come in coma will not survive their injuries. They will die, actually. Most of them die in the first 48 hours.
Sheila had just bought the new horse for her farm, completing a long-held dream of life in the country. Now that dream and her life are threatened on 2 fronts, with a potentially lethal head trauma and a collapsing lung. Trauma team leader Dr. Rizoli looks at Sheila's chest x-rays in the hope of discovering the cause of her collapsing lung. And what he finds is not good. Sheila can't breathe because she's got not 1, but 3 broken ribs. These broken ribs make the insertion of the chest tube extremely difficult. It will be like trying to pull a thread through the bent eye of a needle.
Yeah, she has.
The team gets the chest tube in, and Sheila is able to breathe again. But she's not out of the woods yet. Doctors still must contend with Sheila's massive head injury.
It looks like that her only injury is her head. What I want to know is very quickly is that does she have something in her brain that we can repair surgically? The CT scan can tell us if there's some surgical intervention that we can offer her and then improve her chance of having a better survival or a better outcome overall.
Trauma team leader Dr. Rizoli has stabilized Sheila, and now he needs to determine whether her coma is caused by a potentially lethal bleed in her brain. Dr. Rizoli must see a precise image of Sheila's brain before he can decide if she'll need life-saving brain surgery.
So I want to just get her out of the room here quickly, go to CT scan, find out exactly what's wrong in her head. Okay, so why don't I go to CT then? The CT scan will basically to determine if there is anything that we can do surgically that can change her outcome. Looks like it's mostly her head.
There it is. The CT scan reveals a small area of bleeding in the brain. This could be just the clue Dr. Rizoli needs to help him understand the cause of Sheila's coma.
The CT scan basically shows a bleed inside her brain, so there's a contusion to her brain, the small bleed. And And also inside her ventricles, there's a lot of blood inside the ventricles in her brain. So that suggests that she did have a severe head injury.
This internal bleed creates deadly pressure in Sheila's brain. She will need immediate surgery to stop the swelling before it causes irreparable damage. It's been 26 minutes since horse lover Sheila was brought to Sunnybrook's trauma unit, suspended in a coma. CT scans revealed that a bleed in her brain was causing dangerous swelling. Now she needs immediate surgery before her brain cells begin to die.
So probably what they're going to do is that they're going to put a catheter inside her brain to measure the pressure inside her brain. We cannot allow the brain to go so swollen that it's going to actually compromise the blood supply to the brain, but there'll be no other surgical intervention.
Even if the surgery is successful and the catheter works to reduce the pressure, the chances of Sheila ever regaining consciousness are slim. She will be closely monitored in intensive care over the next 48 hours. The trauma team and her friend Lawrence have done all they can. Now they wait and hope.